Well, good afternoon. You're listening to the new WCEG Network on WCEGTalkRadio.com. Click your live stream tab or watch us live on your smart TV, YouTube, WCEG Network. I'm Celeste Giordano, your show host, along with my guest, Bonnie Dobbs, with the Medicare and other red tape, and you're listening to the Global Legacy and Wealth Building for the next hour. We're the worldwide community empowerment group where we speak life into the community. Like us on Facebook, follow us on Twitter, and on Instagram at WCEG Network _talk_radio and at WCEG Network. We also have some new platforms through Apple. We go to the Apple Store and search WCEG Talk Radio. Also, we're on Roku. And last but not least, our disclaimer, the topics and opinions are those of the show host and guest and not WCEG Network. Thank you for your continued support. And thank you, Penny Rogers and our WCEG Network family and board for this opportunity to serve your community, I should say our community, and to talk with everybody today about Medicare and other red tape. Our special guest today is Bonnie Dobbs, and this is, I think, our fourth year that we've had Bonnie Dobbs as our special guest. She's a master in Medicare and other red tape, and I'm telling you, there isn't anybody that I would recommend other than Bonnie for all your questions, and we're going to do our level best today to answer those questions for you, because I'm sure you're getting your books in the mail and you're getting all kinds of paraphernalia about Medicare. So with that being said, Bonnie, welcome to our show today. It's so great to see your beautiful face and so glad to have you as a guest today.
Well, thank you, Celeste, and thank you, Penny, for having me back again year after year. I just really appreciate and enjoy being on your show, guys. So thank you.
Absolutely. We got a full hour, and I have some questions. I put it out on social media, Bonnie, for some questions for people if they had any questions that they'd like for me to ask. But what I'd like to do is just read a little bit about you that you sent to me this information, and it said, wouldn't it be great if we could find someone who truly understands the Medicare process, someone we can trust to help us make this important decision with a free consultation? Our guest will be Bonnie Dobbs, founder and owner of Medicare and Other Red Tape, LLC in Atlanta, Georgia. Just after obtaining her insurance license, a member of Bonnie's family developed Alzheimer's. While visiting him in the memory care facility, Bonnie found families were very confused about Medicare. She chose then to specialize in Medicare and has become an eternal student dedicated to helping the aging community. This has opened opportunities to share her knowledge with thousands of people through classes, seminars, workshops, and panel discussions. Bonnie has written articles for Ask the Expert and the Atlanta Journal-Constitution, and is the Medicare expert that sits on all the AJC's aging panel discussions. As broker, Bonnie Dobbs and her team are contracted with all the major insurance carriers, and probably some we've never heard of, and are very active in multiple states. And I want to congratulate you on your most recent newspaper article. I think it was this past Sunday, was it?
Absolutely. Yes. Just a couple of days ago it was published. So thank you.
Absolutely. So Bonnie, everything's been going well for you and the Bonnie Dobbs Agency the past year?
It has just been absolutely tremendous. You know, for 5 years, I sat on the panel, on all the AJC panels for the Aging in Atlanta series. And then in 2020, when COVID shut down America, at that point, they asked me to start writing articles. So since then, I have been writing a couple of articles each year. Usually they are published in March and October of each year. And that's a good time frame, about every 6 months, because it allows me to provide updates on what may be new coming down the pike, for people. And then also in the section that I just wrote about that was published on Sunday, I normally just take a few common questions and maybe some not so common questions and expand on those for people. So that's how I am able to get to a lot of different people that are at different, places in their Medicare journey.
Absolutely. So let me ask you something. I have not read that article that was just published on Sunday, but what I would love to know is what is the number one takeaway you want people to have from this article? And I'm sure that we can probably put a link up here for people for that article.
Yeah, well, what I did with this particular article, there was a few things that I felt was at this time of year needed to be addressed. So, excuse me. So for people who already are on a plan during the month of September each year, they get a notice in the mail, and the name of it is Annual Notice of Coverage, and we call it ANOC. ANOC, okay? And what that does is it allows you to compare the current plan that you're on with what that plan is going to look like next year if you don't do anything. Because if you don't do anything, the plans will just roll over. Well, from year to year, there may be an increase in cost. There may be a decrease in cost. There may be additional benefits added, or there may be some that will be eliminated for the following year. So if you're on a Medicare Advantage or a drug plan, look for that in the mail. There's no specific date because they mail them out during the entire month of September. So before annual enrollment every year, you want to get that and, check out what you have. That's the first step. And then, another thing that I address, this is big and it's been all over the news, during COVID, the people that were on Medicaid did not have to update their information. Now, normally people that are on Medicaid have to update it annually, like let them know what their current status is and if they've moved and what their income is, because Medicaid is based on income. And what many people doesn't know is Georgia was number 5 in the nation of people that lost that Medicaid coverage. Well, people that are on Medicaid and Medicare, they have to do something. Now, you don't lose Medicare because you lose Medicaid, but they're different plans. Okay, they're plan specific for those on Medicare and Medicaid. So I addressed that issue. Also, that was one of the questions because that's very important. It's big, it's affecting many, many Georgians. And then another thing is a couple of years ago, the insurance companies started offering plans for veterans. And so many veterans are unaware of it. So if you guys know any veterans, you can have them call my office, and these plans offer them additional benefits, and maybe it's a buy down on their Part B. So Part B this year for the average American is $164.90 a month. So for a veteran, if they can get one of these plans, they may pay, say, $50 less. So that's like putting money back in their pocket. So I address that also. So that's the type of things that I talk about. Like I say, I'll just do a question and then I'll answer it. And I try to be concise so I can get several questions in each edition. And I must say, from the time I wrote the first article, it was only like 500 words, and then as we have gone along, it's just gotten bigger and bigger. And I think this one's was like 1,500 words. So this was a large article, but it allowed me to cover a lot of territory that is important, like I say, to people that are in different stages of their Medicare.
Bonnie, you just prompt me to ask you a question, bringing up the veterans. And we appreciate all of our veterans
Absolutely.
out there. And thank you for serving our country and everything. We appreciate that. So, and $50 is a lot of money. I mean, that's $600 a year. So
absolutely.
Is that only good for the actual veteran, or would that be good for the spouse as well?
Just the veteran.
Just the veteran. Okay.
Just the veteran. Yeah. And so whether you're VA, Champ VA, or TRICARE, these plans can help put money back in your pocket, maybe, or definitely give you some additional benefits. Now, everything with Medicare always has rules, where you live, service area specific, that's the number one rule. So anybody that that's a veteran that is interested, you can have them give us a call. We would be more than happy to research every plan that's available to them.
Absolutely. And Bonnie, why don't you go ahead? I know it's early in the show, and I know that WCEG Talk Radio has put it in the chat, but if somebody wanted to have a complimentary call with you, Bonnie, what is your phone number, or how would they reach out to you?
Sure. My office number is 770-373-7541, or they can go to the website. It's insuranceandotherredtape.com, or you can simplify it and just go to bonniedobbs.com, and both of them will take you to the same place, and you can find out information there. And from the website, you can also send us a question or complete a form, and we can research all the plans that's available to you. So we would be more than happy to do that.
Absolutely. And also, since we're giving some information out there, Bonnie, I know that you're licensed in several states. I don't know how many there are. Is it a lot, or can you list some of them, or?
Yes, so, we're in about 14 states. I can't remember all of them off the top of my head, but let's see. I'll start at the bottom. We're in Florida, Georgia, Alabama, South Carolina, Tennessee, Ohio, New Hampshire, Indiana.
Are you in Kentucky?
We're not. I don't think we're in Kentucky. We're in like 14 different states. But it's late in the day, and I can't remember every single one of them.
That's okay. Yeah. I had a friend in Kentucky that was asking about that, and I was just curious. As a matter of fact, I gave him your name, and so I wasn't sure if you were licensed in the state of Kentucky, but you are Ohio, so that's good. We have a lot of colleagues up in the Ohio area.
Great. And I do have an affiliate that I work with. It's interesting. We're in a couple of states that they're not in, and vice versa. So between the two of us, we cover all the states. So it works out really good. It's a really good partnership, and they've just done a tremendous job. And I always get good feedback. Carol, I think I just got off the Zoom.
No, you're still with us. You're still with
okay.
us.
Somehow I'm not showing I'm with you. I'm so sorry.
Well, I see you, and you're loud and clear. So you're
okay.
Good.
Well, I'll just keep on going here. Okay.
Yep, we'll keep on going. So what are some of the new rules put in place last year that's going to remain for 2024?
Oh, yeah. So we're all familiar with those misleading, that's a good word, commercials you know, from all the household names that we grew up and learned to trust. And now all of a sudden those folks are not our friend because they got on the television and, you know, made us think that, or tried to convince us that we were missing benefits or missing out on something. So as a result of all of that, we have to record and keep every conversation. So starting last year, if you called an insurance company or you talked to your insurance broker, if you were discussing plan benefits or costs, that had to be recorded. And guess what? We have to house those recordings for 10 years. I'm
Right.
sure enrollees, you know, are not happy about that. And we're sure not happy about that. It created havoc, created a lot of problems. But it's because those unscrupulous agents could not be trusted, and they were enrolling people and they didn't know they were being enrolled, and just, you know, just really running roughshod over so many seniors. So that's one thing. And then the other thing, and this really bugs me, at the beginning of every call, and on all of our marketing materials, and on literally, if I send you an email, I have to put this clause, okay? And since everybody can't read it, I'm going to read it aloud to you. So if you call me and we have a conversation about going over your plans, either I have to say this or I have to play a pre-recorded message that says, we do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-Medicare to get information on all your options. Now, if you call me and you trust me to help you, and I read that to you, does that create doubt in your mind? Like, well, why isn't she, you know, she says she can compare every plan, but she's also saying we do not offer every plan available. Okay. So the reason why I don't offer every plan available is, to be honest with you, Celeste, some of these plans and some of these companies are not worth your time or mine.
Absolutely.
And I am never, ever going to put my client on with a company on a plan that the company has not been in business at least 4 years. I'm only going to enroll my clients in companies that are dependable, that are stable, that we know they're going to be there whenever your invoices come, you know, whenever you go to your doctor, you want to know, or the hospital, you want to know that that claim's going to be paid. And so that's one of the reasons. There are a couple other companies, and there may not be so on the up and up about certain things that you know how it is whenever you're in any business, you know more about what goes on behind the scenes, you know.
Right.
So I hate that clause because it does create doubt, but there is a reason, and it's a good reason. You don't want me to put you on one of those companies that, you know, all of a sudden they're splashing their information everywhere, trying to look like they're the best thing since ice cream, when you don't know if they're going to be there and even until the end of the year for you. So yeah, I hate those two things that were put in place last year that they're keeping in place this year, you know?
Right. Well, unfortunately, we just, you have to do what you have to do. And
Absolutely.
I know of a person a few years ago, rest her soul, she's in heaven now, but she had some people that came in their insurance and did things, and and took advantage of her. And it's a shame that we have people out there like that. And so anything that we can do may be a little bit difficult for you, this or that. This is why I love referrals, and somebody that has a personal relationship with somebody that speaks volume about them. And my husband and I were just having this conversation last week, and he says, who's your guest this week? And he says, is it Bonnie Dobbs, the lady? He knows of you. And he wrote his questions down. So I've got some questions for you.
Great.
Along with some other
it.
questions, from other people. But and he says, I think it's great that you trust somebody like that. And in our women's money mastermind group, I just had to did a 3-part series with a financial advisor. It's my reputation at stake when I bring these people on, as guests, that I want to make sure I've done my due diligence with these people. And I know that I'm going to stand behind these people, that, they're going to do what's right, because not everybody does what's right, Bonnie. And I am thankful and blessed that you are a person of integrity and character, and you always do the right thing, putting other people first. And so we appreciate that very much.
Thank you. Yes, one of the things that from the very beginning, whenever I became an agent, and I have taught every one of my agents, okay, we have so many people call us and they want their plan reviewed. Well, if somebody's on the best plan for them, I'm just going to say, stay where you are, give me a call this time next year and we'll review again. Whereas 99% of the agents, they would find something wrong with that plan or create doubt in your mind. We don't do that. If you're on the best plan for you, I want you to stay there, okay? Because I'm here to help you. And if I can, I will. And if I can't, I'm going to tell you the truth, because I would much rather you trust me that if I do change your plan, you're going to benefit from it, okay? And I want your referrals. I want people to feel comfortable when they refer me. And the biggest compliment I have is when somebody sends their mother to me. And I will never forget, this happened to me just recently. I was at a senior center, and there's so many people that work there, number one or number two. Instead of their parents coming, it was the children or the caregivers, and every single one of them was, and I was saying, oh my God, I wrote your mom and I wrote your mom and wrote your mom. And I just think that's the highest compliment. If you send me your mama, I know you trust me. So I get a lot of mamas, okay?
Absolutely. And I would like to say something, because in our Women's Money Mastermind series that we did with a financial planner, one of the questions that came up, and this has to do with what you're saying with, is, people say, I have a financial advisor, this, and so they may be selling you on different aspects of where to put your money, because they're making money off of everything that they do to get you to change where you're at. And that's the same thing when it comes to, and correct me if I'm wrong, Bonnie, I'm not perfect, that, if you have a good plan, like you say, that you want these people to stay on there, but, some people will want to change it, because do they not make money off of putting somebody new on another plan?
Absolutely. And that's the reason why, that's what I was saying. If you call the majority of agents and say, can you review my plan? They're going to find something wrong with it, because they are not going to make any money if they don't write your plan. Okay. Right. We don't run our business like that. If you're good where you are, I'm going to tell you are. If I can help you, I'm going to say, we need to talk. Okay. I have had people get mad at me before, because they would say, well, I don't care if I am on the best plan. I want you to be my agent. No, you don't. That's like going to a surgeon and saying, I want you to cut me so you can be my surgeon. That makes no sense. It's like, come back next year. Let's talk about this, and if I can help you, absolutely, but we get so many referrals from people that we don't do, because they know that they can depend on us to do the right thing.
Absolutely. And, and this is why I love referring people to you, Bonnie. I love hosting you on the show through WCEG Network. is because you always do what's right. That's important. And with my consulting business and my clients, I tell them, you know what, you may go to a networking event and you'll meet people, and you know what, they may not be your ideal client, but they may know somebody that is as a referral. And that's what
Right.
it's all about. And that's when you serve others first and you do the right thing, because not everybody is your ideal client. And if you're on a great plan, you know, you have the integrity to say you're on the best plan possible, you know, and keep them there. You know, oh, by the way, do you know anybody else that maybe I could have a conversation with?
Right. Exactly.
So, and that's just, and that's the kind of agent you want to have on your team. That's the way I look at it.
Absolutely.
And I am so grateful to have you here today, Bonnie. So let me ask you something. We know annual enrollment period starts next week. Can you explain that? And are there times when a person can enroll? And what about when they are first eligible for Medicare, if they are past 65 and getting ready to retire?
Oh, yeah, absolutely. So if you're on a Medicare Advantage plan or supplement plan, every year from October the 15th to December the 7th, and October the 15th, I think is Sunday, you have that is a time when you want to compare the plan that you're on with all of the plans that will become available for next year. So when you enroll in a plan during annual enrollment, the new plan will start January the 1st of the following year. Or if you're happy with the plan you're on and do nothing, it will roll over and your new plan will begin January the 1st. And that's what I was talking about earlier. If you receive when you receive your annual notice of coverage in September, you can do that line to line comparison with the cost this year versus next year. But for during annual enrollment, that's when you can compare not only the plan you're on for next year, but all of the plans that may be available. So the reason why some people don't change plans every year is because they are already on a benefit-rich plan and they're happy with it. And maybe their health has not changed, their doctors, their meds, their lifestyle, everything's remaining the same. So if you do nothing, that plan will just roll over. But during annual enrollment, that's when you can compare, and especially if your doctors have changed or your medications have changed, you'll want to have that annual review because you want to find out if there are other plans that will reduce your cost, and maybe give you some more benefits also, or maybe something is more important to you this year. Maybe you're getting physical therapy and you want to find a plan where you can reduce those physical therapy payments, or maybe that you've got joint replacement coming up and you have a new doctor and you want to find out if that doctor is in your network. So this is the time of year whenever you can check out all of those plans. And then, of course, like you said, there are other times when people can enroll. One is when they first become Medicare eligible, of course. And one of those times is whenever you're turning 65 and you're not working any longer. So if you are turning 65, then you have the 3 months before, the month of your 65th birthday, and then 3 months afterwards to enroll in a plan. If you are going to work past 65 or your spouse is working past 65, you can delay enrolling as long as the company has 20 employees or more. That's the buzzword here. So if for all you guys that's listening to this and you're thinking about working past 65, make sure that your company has 20 or more employees, because if it does, then it's Medicare equivalent. If they do not have 20 employees or more, it is not Medicare equivalent. And if you don't enroll, you will get a penalty. Okay. So if you're working past 65, there's more than 20 employees, you and your spouse can delay enrolling in Part B. Now, every year, without fail, several people will call me. It's already happened today, actually, and say, oh, well, whenever I turned 65, I wasn't on any medications and I didn't need, I was very healthy, so I did not enroll. So for those people who didn't enroll, now the federal government's way of getting back at you is they say, there's a certain time when we're going to allow you to do this. And that's January the 1st through March the 31st. So regardless of when you may have become Medicare eligible, if you didn't enroll when you're supposed to, you're going to have to wait until that time frame following year to enroll, and then your plan will start following month. Okay, so that's January the 1st to March the 31st. And now, and the opposite of that is if you are continuing to work and you are with a company that does have 20 employees or more, if you start Medicare anyway, that's like paying for something you're not getting. Okay, you can't because you're paying for Medicare, but you're using your you're using your employer or your spouse's employer coverage. So you're paying that $164.90 and you don't need to. A couple of years ago, the lady that paid the most, I think, she was 72 years old. She retired from her day job whenever she, from her regular job when she turned 65, but she wanted to work part-time. So she went to work for the school system, driving a school bus. And when she was 72, it was like, okay, that was enough. Yeah. She did not know, since she had coverage through the county, that she didn't have to enroll in Part B. So she paid that $100 and something a month every month for 7 years. I mean, do the math on that. I think it was over $10,000 that she had paid. And the federal government, they're not going to reimburse you or send you a refund, So it was literally like taking all that money and throwing it out the window. And this lady, honestly, she did not have that type of income, and she never had. So, I mean, that $10,000, that was really a big deal. I mean, she was absolutely crushed. And every time I speak, because I see her daughter quite often, when I am speaking, I never say what her name is, but I always use her as an example, because what you don't know with Medicare can really cost you a lot of money long term.
Well, and that leads to one of my questions. When you turn 65 and you're still working, you have to sign up for what I always get the two confused.
You don't have to sign up for anything if you're 65 and working. The key here is, does your company have 20 employees or more? If the company has 20 employees or more, you don't have to enroll. If you are contributing to an HSA, you cannot enroll in A or B, either one. You can't be in any part of Medicare. Okay. So, most people, if they're not contributing to an HSA, they go ahead and allow the Part A to start, because it will start unless you specifically require that it not start. Okay. Right. But you're in charge of that Part B if you want it to start when you first become Medicare eligible.
But I think most everybody feels that if they're still working, does the Part A at 65, right?
Unless you're contributing to an HSA. If you're contributing to an HSA, you can't be in any part of Medicare. So you have to contact Medicare and tell them to not enroll you in your Part A, correct?
So what if somebody is, thinking about retiring and at 67 and a half or whatever, and their spouse still works for a company and they have insurance benefits with them, would you drop that insurance coverage for yourself if your spouse worked for a company that provided insurance and pay for what you get through Medicare with Part B?
It depends. I always have people find out what they're paying for their coverage through their employer versus what they could get on an individual plan, and whatever is the least expensive with the most benefits win. So I can handle those comparisons. If somebody who is working, has more than 20 employees, and spousal benefits too, whether it makes more sense for them to keep the spouse own or both of them own. Because usually, Celeste, and people don't know this, usually the employee, their monthly premium is very small. It's whenever you add a spouse or family, children, whatever. Okay. That's whenever that monthly premium goes sky high. I mean, I literally had somebody, they were paying like $300 something a month. Whenever they found out if they separated out the employee from the spouse, the employee's coverage was like only costing them maybe $63, and all that other 200 and something, almost $300 was just for the spouse only. So that's what I get you to do. Separate it out, find out what is your portion, and then I can guide you accordingly and let you know if there's a plan that would be more beneficial to you as far as benefits and cost you less, because that's what everybody wants.
So could you keep both of them or no, you have to give up one or the other? And
can't be half pregnant with it.
Yeah, well, and the other thing is you have to make sure that you have the coverage, if you have doctors that you want to see and stuff like that are covered with that. So that's another question on whether or not you want to go ahead and take your retirement and give up this, if it's a Cadillac insurance with an employer versus, what you're going to get with Medicare, right?
Well, sometimes Medicare is usually the Cadillac plan, okay, versus the employer plan. Okay. Sometimes it's a wash. Sometimes the employer plan costs so much less, so there as many variables as there are stars in the sky, I think sometimes. And there's not like any one set plan or premium. All employer plans they're all over the place. I got somebody today, she pays $191 a month and has a $2,000 deductible. Well, based on all of her personal variables, she needs to stay where she is.
All right. Well, so to this question that I just asked you, one of the questions that somebody sent us, it was called split benefit strategy. And they said if spouse files for Social Security benefits after full retirement and receives benefits based on their income record, and then the other spouse later claims benefits at age 70, is the spouse eligible for the highest of the 50% at full retirement age or at age 70?
Okay, you're talking about Social Security benefits, and I'm the Medicare queen. So yeah, you would have to talk to somebody that handles Social Security benefits, because the difference in Social Security and Medicare is Social Security is money and Medicare is health insurance.
Okay. Well, I'm just reading the question that they sent. Okay. Sure.
Absolutely. I think they're right though, that they can about splitting the Social Security, I would call the Social Security Administration and ask them, because of course you're going to get more money if you wait until you're 70. So
Absolutely.
yeah.
So, what are the advantages you provide to clients as a brokerage versus an individual agent? And how is that you can offer your service for free?
Well, what people mostly do not know is commission is already built in the plans, whether you enroll yourself or whether you call the insurance company direct. So if you enroll yourself or call the insurance company direct, then the insurance company just pockets that commission. When you use an agent or whenever you use a broker like what we are, we get paid a standardized commission. So we get paid that commission, and instead of going straight to the insurance company. So that allows you to have an expert review your plans, research everything. They do this every day, all day. They know these plans inside and out. So if you have something specific to what you need, they know which plan to put you on, and they can find out, all of that information. Somebody was asking me that the other day, and I said, let me give you an example of something that is not a big deal to the majority of people, because this is something you may or may not ever need in your life. But if you're getting physical therapy, most of these plans charge $30, $40, or $50 per visit to a physical therapist. Well, since my son got his doctorate in physical therapy, I know firsthand you may have to go to physical therapy 2 or 3 times a week. Or if you've had a stroke, you may get physical therapy one day, speech therapy one day, occupational therapy another day. You may get 2 or 3 therapies in one day. And if you times that $30 or $40 or $50 a pop, I mean, that can ruin a budget in a flying hurry, right?
Yeah, absolutely.
Okay, so if you call me up and tell me that's your situation, I know of a plan where you can get physical therapy on that plan for $15. Have I just changed your life?
Oh, absolutely.
Is that something that you could go ferret out among hundreds of plans? Probably not. Probably not. So that's just one of the reasons why it's good to use a broker who can compare all of these plans and who works with them every day. So those little, finite details. Something else that's one of the companies is adding this year. Do you know what ADLs are? Something daily living. Oh God, what's the first? Adult? No. Oh, I can't remember what the A stands for right now. But it's where you can give yourself a bath, feed yourself, dress yourself, grooming. There's 5 or 6 of those. So right. If there's one of those that you cannot do, this year, there are some plans that will give you so many hours over the course of the year. It's not very many hours, but still 80 hours for somebody to come in to your home and to help you out some would free up maybe a family member who's taking care of you, or maybe you're doing this totally by yourself. Okay. So it's just the little nuances that's hidden into these hundreds of plans. So it just makes sense to use a broker rather than do it yourself. It's just like you're talking about your financial planner. I could do my own financial planning, probably wouldn't get very far. And she could ask me a few questions, right? Find out a little bit about me and how much extra money I have left over in my allowance that we could do something with. And look, she knows all those plans. So she would know where to put my money based on where I am and what my goals are. And that's exactly what insurance brokers can do. We can find out the information about you and what do you need, and then go on a seek and find mission for that.
Absolutely. So correct me if I'm wrong, Bonnie. So what I'm understanding, every year when we have this open enrollment thing right now, that, as people are aging, and I call myself aging because, I'm getting up there in my 60s, 67, I don't mind saying, and especially older people, those 70 and 80, that they need to do a review every year, because maybe this coming year, they're going to have knee replacement surgery. And with knee replacement surgery comes physical therapy, right?
Exactly.
And so therefore, they may not have, like you say, they may have to be paying $50 for this physical therapy on the program they're on. But so you could really change every year if you wanted to. Is that correct? A plan?
Sure. During annual enrollment every year, for those who are on Advantage plans and prescription drug plans, you have the option at that time to compare the plan that you're on with all of the plans that will be available for the following year. So I strongly suggest people who have either been recently diagnosed with something, or during the year, their health has changed, their medications have changed.
Yes,
absolutely. Or what if you're thinking about moving to Florida or moving to Colorado, or what if you want to go spend a month in Europe? You need to find out about your plan and all the other plan options, whether it's your health or your lifestyle, or like you say, maybe instead of the fun things, maybe you did just get diagnosed with knee replacement, and how are your needs going to change? Of course, you're going to have a new doctor that's going to do that. So you'll want to make sure that the doctor you want to go to is accepting the insurance plan that you're currently on. There are other things like physical therapy. You're right, because physical therapy for a knee replacement lasts longer than a week. And if you have to go twice and it's $50 a pop and you only go 3 weeks, look, that's $300. And I'm sure you'd much rather be on one of those little $45, physical therapy visits, because that would be 60, that would be $90. That would be less than $100 and I'm just saying 3 weeks. I'm sure physical therapy probably starts at 6 weeks for most things. And there's many that go above and beyond that. So, but that's just one thing that I kind of keyed in on, because it became a big situation to a recent client.
Well, and Bonnie, I want you to give your opinion on this. And the reason I'm bringing this up is because a lot of us, like at my age, we have aging parents. If I'm 67, we have aging parents in their 80s, things of this nature, and or late 80s and early 90s. And so some of us are maybe just getting into the habit that we're having to help manage our elderly parents and things of this nature. And some people just don't think that we need to reevaluate what program they're on. Like, as a business coach, it's a fourth quarter mentality that we have these conversations with somebody like yourself for our Medicare programs and things of this nature, our financial advisors and our homeowners insurance and stuff like this, because things change with our CPA. So if you're managing an elderly person, you need to be having these conversations and looking into this, because maybe the medications change. Because I know with my mom, sometimes, they're spending lots of money on medication because medication has changed. And then, when they're on a fixed income and a budget, adding an extra $100 to $300 can be devastating to some of our elderly communities.
Absolutely, it sure can. And so that's one thing about the Tax Reduction Act that, I wrote about that in the spring, but Biden, they just passed that last year. And so that's all about reducing the cost of medications. This year, we're not going to see very much of a change. It's going to be a somewhat, they're eliminating the stage 4, which is the catastrophic phase. So once you're in the donut hole, you'll just pay the 25%, whether it's brand or generic, until you've paid out $8,000. And then you're done. Okay. Instead of it going on forever like it has in the past. But starting in 2025, they have put a cap on medications of $2,000. That is going to help so many people.
Right.
Because if you're on a tier 3, 4, or 5, first of all, you have a nasty deductible. This year, the most the insurance companies were allowed by the feds to charge was $505. Then you would have to pay the full cost of the drug till you met that nasty deductible. Then you would start paying your tier cost. Next year, that $505 has been increased to $545. So if you're on a tier 3, 4, or 5, you'll have that to pay before you start paying your copays and go into the second stage. But there's also a couple of other times when you can change your plan. Like they only started this a couple of years ago. And so now this, what I'm going to talk about, is just for people who are on Medicare Advantage plans only. So during annual enrollment, which is coming up October the 15th through December the 7th, right? People may change or they may stay on their plan. Well, then from January the 1st until March the 31st each year, now, if you're on a Medicare Advantage plan and you're unhappy with your plan for whatever reason, whether you're just not getting the benefits you thought you were, or maybe your needs did change, you will have a one-time opportunity to switch. You can either switch to another Advantage plan, or you can switch to a Part D plan and see if you qualify for a supplement plan. Now, if you're going to do that, you'll want to do that early on. So you have ample time for the supplement plan to go through the underwriting process to see if you get approved. You don't want to wait till the last minute and try to do that and then not be able to get approved with the supplement plan. But January the 1st through March the 31st is called open enrollment period. Okay. And so if you're on a Medicare Advantage plan and you're not happy with it, you can switch to another Medicare Advantage plan. And then something I want to address that people don't realize this. If you're on a Medicare Advantage plan and you move into a nursing home or you move out of a nursing home, you do have a one-time opportunity to switch plans, because face it, if you're going into a nursing home, you're probably not having a good day, right? So your needs have changed. Something has happened. Maybe you had a stroke. Maybe you had a major surgery, but something major has happened in order for you to qualify to go into skilled nursing. So you are allowed an opportunity to switch plans while you're in the nursing home. And then you're offered another opportunity to switch plans once you get out of the nursing home. And that's really important because if you're in a nursing home, things have changed. Then by the time you rehabilitate and can get out of the nursing home, maybe you have new doctors now, and maybe you have new meds. And so you need to have your plan reviewed and to change it accordingly. But those are 2 times outside of annual enrollment, which is coming up, that it's important, I think, for everybody to know about Medicare. And there's just so many different rules and requirements and deadlines and so forth. It's a lot to remember, but I always do my best to let everybody know the most important things. So I hope that really helps a lot of your viewers.
Absolutely, Bonnie. And we've got about 4 minutes. And before I ask you your last call to action to leave with our listeners, I really want you to give us a Cliff Note version on the importance of if you're caring for an elderly person or for elderly people, why it's important to do yearly reviews with an agent like yourself.
Yeah, well,
Somebody,
one thing, go ahead.
I can't even imagine, but can you just think of how many people that maybe doesn't have any kind of children helping them or whatever, they just, nothing changed. They don't know what they don't know, Bonnie.
Absolutely.
And then if you're somebody helping an elderly person, you don't know what you don't know about having that conversation with that elderly person.
Yeah, the number one thing that a caregiver, or well, let's put it this way, it starts before the caregiver. The number one thing as we age that we should do immediately is us decide who we want to have a POA as our power of attorney and officially get that document created, because you want to decide who's going to take care of you, not maybe your child, the frivolous one who thinks life is a dinner party, right? Or maybe you don't have any children and you're going to have to choose a niece or a friend. You want somebody stable and somebody that's going to have your best interest in mind. So the first thing you need to do is always choose your power of attorney and get those legal documents created before it's too late, before you're no longer capable of doing it. And then have your plan reviewed. And especially, and I can't stress this enough, especially if your plan has not been reviewed in a couple of years, or if your situation has changed, or you think that, or you've been diagnosed, or you may feel like you just are going to need a shoulder replaced or something. Have that plan reviewed so you can be out there and on top of it and save yourself money.
Absolutely. We have 1 minute left, and Bonnie, I can't thank you so much for sharing all this valuable information with our WCEG Network community. What is the last call to action you'd like to leave with our listeners tonight?
Number one is I would like to tell everybody, go ahead and call now. Don't wait till the last week of open enrollment. We're busy. The good agents, they're going to be busy. Okay. So go ahead, get your appointment nailed down now. Just know that not only can we help you in the state of Georgia, but we're in about 14 other states. And I have agents that live in other states. So if you have family and friends outside of the area, that we can help you, and we will be happy to do that. Thank you for having me on again this year. I greatly appreciate you.
We adore you. Our hearts love your heart, and we just appreciate your character, your integrity, and your genuine interest in helping people and serving them first. And in closing, I just would like to congratulate our WCEG network. They're the #1 community talk radio international platform, and we just appreciate you and the opportunity that you give this wealth of information that we can bring to the table to give to the community. And Bonnie, we wish you a wonderful and blessed day and week, and look forward to speaking with you again soon.
Thank you very much, Celeste and Penny. I greatly appreciate you guys, and I hope this information helps your listeners.
Absolutely. And listeners, if you're listening, make sure you jot down Bonnie's information, give her a call. Like she said, don't wait till later. Do it now, sooner rather than later. And let's get those premiums or those programs evaluated on where you're at and reviewed, and go to somebody that's going to take your best interest at heart. So thank you, Bonnie. Thank you, WCEG Network. And thank you for the community that listens to us every month. So thank you.